Hi everyone, my name is Rob Hoffman from the Office of Overdose Prevention. This video will demonstrate how to use fentanyl test strips to test drugs for the presence of fentanyl. Fentanyl and the risk of overdose are scary, so we appreciate you taking the time to watch this video to learn how to use fentanyl test strips. It's important to be aware of stigma and avoid using judgmental language when talking to people about test strips. Stigma can isolate the very person we're worried about. Fentanyl test strips can be a valuable tool to help people make informed choices about their use, but they have some limitations. Fentanyl test strips don't tell you how much fentanyl is present or how strong it is, only whether or not fentanyl was detected. When fentanyl is not detected, it doesn't mean the drugs are safe or unsafe. Fentanyl test strips are extremely sensitive and can detect fentanyl when it is not present when testing methamphetamine. This is referred to as a false positive and can sometimes be prevented by diluting the drug in more water and retesting it. This is how to use fentanyl test strips. Open the package of fentanyl test strips and take out the test strip. Only handle the strip's blue end. You can see a tiny hand icon. The other end has wavy blue lines. This is the end you insert into your mixture of drugs and water. You don't want to insert it past the line next to the wavy blue lines. Lastly, results appear in the center of the strip. Let's walk through testing drugs with a test strip. Step 1. Put a small amount of your drugs, 10 milligrams, in a clean, dry container. 10 milligrams is roughly enough to cover Abraham Lincoln's hair on a penny. Step 2. Add water to the container and mix together. For most drugs, you'll need a half teaspoon of water. If you're testing methamphetamines, use a full teaspoon of water. Step 3. Place the end of the test strip with the wavy lines down in the water and let it absorb for about 15 seconds. The wavy lines represent water. Step 4. Take the test strip out of the water and place it on a flat surface for 2 to 5 minutes. Step 5. Read the results. Test strip results include a pink-red control line which appears closer to the blue end where you hold the strip. This line should appear on all results. If it doesn't, the test is invalid. If 2 pink-red lines appear, fentanyl has not been detected in your drugs. No fentanyl equals 2 lines. If 1 line appears, the control line, closer to where you hold the strip, and no other lines appear, the strip has detected fentanyl. When testing methamphetamine, it's recommended to add another teaspoon of water to your mixture and test it again with a new test strip, just to be sure. Invalid results can occur. A single pink line appears closer to the wavy lines, or no lines at all indicates an invalid test. If you get an invalid result, test your drugs again using a new test strip. The safest thing to do is not use drugs. But if people are going to use, they should follow these safety strategies. Never use alone. So someone is there to help if you overdose or have a bad reaction. Always have naloxone ready, regardless of the type of drug you're using. You can get fentanyl test strips at the SFDPH Behavioral Health Pharmacy at 1380 Howard Street has small quantities of test strips available. If you have any questions or need additional information, please email overdoseprevention@sfdph.org.